Welcome to the Healthcast, where healthcare professionals and experts from the UK and worldwide discuss all things healthcare, providing world-class insights from the very best in medicine. And today I have the pleasure to speak to Ege Sandalli, who is currently the Business Development Manager of IDC Turkey, Istanbul Dental Center. And we are here to discuss all things Turkey teeth, why that is an issue, and how we can fix it, basically. Ege has experiences in working in the US because he graduated from Franklin University. He majored in computer science and technology. He worked in innovative companies in the fields of internet technology. He even established his own company in 1998 in New York, and he also provided advice and consultation to Turkish and Asian manufacturers to enter the US market since 2001. So Ege, thank you so much for joining us here today, for joining our podcast.
Thank you. My pleasure.
You obviously worked a lot in the US market, and now you're back in Turkey, you're in Istanbul. And tell us, what exactly is it that you do for Istanbul Dental Center?
Basically, I'm in business development, and what we do here is we basically create strategies inside the clinic on how to serve the international patients better by making sure that we relay the right communication channels through to our patients, and we inform them the best way we can, and we design our whole structure around it, so to speak, so that the patients are well informed about what they have to do before they arrive here, and what kind of treatment is expected that they're going to receive when they do arrive. And we want to be as transparent as possible as a clinic, and that's why everything is handled before the trip takes place. And that's what we do here is fix that part mostly so that there's no question marks while they're in the air, so to speak.
And I guess transparency is a really, really important point, because in the age of dental tourism, where lots and lots of people from the UK and the US, they come to Turkey because they get a good service, or even a better service than in their home country, and they get it done for much cheaper. And I think this is the major aspect. But equally, then I guess you are aware of this, and everyone listening to this podcast is aware that Turkey dental tourism has got a very bad reputation for cases where people come to get their veneers done, their teeth start falling out, their crowns start falling off. So I understand that lots of people considering these dental treatments have become much more cautious and much more concerned about potential consequences. And this is why I guess transparency and communication, as you said, is really important to the patients.
The Turkish government has something set up for health tourism, and there's a certain certification that they pass out. Now there's thousands of clinics in Istanbul alone. And what the patients have to do basically in terms of research is that they need to make sure that the clinic itself is certified in health tourism. The governments, they really do try to make sure that there's no underground clinics acting and posing as dental clinics, and there are quite a few of them, and it's really hard for the government to really keep a track of this. But at the same time, I think there's a lot of responsibility for the patient as well to do their right research online and make the right choice for them, whatever health treatment they're seeking. Make sure that the clinic they're going to be working with has some sort of a history. It's not something that just popped up within a year or something. That's kind of like a warning sign. I'm not saying that they're bad, but it's a warning sign. They need to look more into it, make sure that it's not something that got created by someone that is not even a dentist. It could happen. I mean, they might have the money to promote themselves, out there on the internet, and all of a sudden, you're getting some treatment from someone that is not a professional. So it's best to make sure that, you do your research of the dentist about the clinic ahead of time before you commit yourself.
Absolutely, because I understand that lots of new clinics, they invest very extensively into Google Ads, especially. So if you go and do a little Google search, the first clinics that may show up are not necessarily the clinics that are potentially the right fit for you. Is that right?
Correct. That is correct. I mean, Google has a nice algorithm, but at the same time, it is dependent on the content of their website, basically. And if the website has been around for a long time, that's a really good indication that clinic has been around for a long time as well. And I mean, we do Google Ads as well, but like you said, it's pretty much how much money they put in cost per click. So if they put a lot of money down, they trump everybody else in the competition, and all of a sudden they're showing up first in the results. And just like you said, it might not be the right choice. So it's better to do more research, go in the website, see exactly who the dentists are, and research the dentists themselves. That's always a good way to start off the research portion of the clinic and the doctors.
Who is the authority that certifies the clinics and the doctors in Turkey?
It's the health ministry. The health ministry of Turkey is the one that does the certifications, and we have our own. And there's, I believe, not too many clinics are given out this certification, because there's a certain process that takes place, and you have to qualify for it, especially with the language. In our clinic itself, I mean, we have employees that speak in combination. We have Russian, French, Italian, Arabic, English speakers, Norwegian. I mean, we have a whole spectrum of languages that are spoken here, and that really helps in communication with the patient. And that is one of the qualifying factors that you have to have in order to receive the certification from the government.
Absolutely. So coming back to Istanbul Dental Center, I understand you guys work with the UK particularly, but also with the US a lot. So I understand you have commercial operations in New York. Is that correct?
That's correct. Yes, we have some agencies, offices in New York and New Jersey. And we bring in patients from the US, and also we have a lot of patients coming in from all over the globe, really. And we've been really fortunate enough to be one of the first to be in the health tourism. We've been around for over 12, 13 years now. And we were one of the first clinics to actually start this, even before the government started this health tourism section of health care. So we were really fortunate enough to be one of the first ones to be in the market. So that helped us out a lot to get our name known internationally.
And you guys are a family business as well?
Yes, it's a family business. It's basically myself, my cousin, I got my father, my uncle, my aunt. So we have been doing this for quite some time, and it's a closely knit family, and everyone is a dentist. But myself and my cousin, we chose to be on the business part of it mostly. You need that too, They don't have time to actually, the dentists don't have the time to actually handle the business portion of it, which is really a really important part.
Coming to the treatments themselves, what is it that people actually want? So when people say, I want the turkey teeth treatment, what are they referring to?
Well, many people actually refer to that as I would say, Hollywood smile. And everybody's really excited to get this new teeth, and because it's basically, it gives people a lot of psychologically a lot of confidence to have that new smile. Maybe you have some crooked teeth, or you have some teeth missing, or all of the above. So basically, just fixing that really gives that effect on your personality that changes your life. And that's what clinics like us, that's what we're ultimately trying to achieve. Actually, it's happy patients that actually refer us to other happy patients. That's the best way of marketing.
Word of mouth is the best. That works for everywhere.
We really try to make sure that each and every patient that leaves here with a smile, not because they can smile better, but also they're very content with the treatment they receive.
But the treatment means, is it veneers mostly that people come to? They want sort of that type of smile.
So basically, what we have is we have laminates and veneers and crowns, and basically it depends on which one we use for the Hollywood smile, turkey teeth, or whatever you want to call it. It's basically how much crowding you have. If you have too much crowding in your teeth and it's too crooked, then you're going to have to use something called, the crowns, because we would have to actually cut the teeth. There's a lot of invasive operation on the teeth there. You cut the teeth into a shape, and then you put a whole crown. That's why it's called a crown. It basically crowns your own tooth. And there's laminates and veneers, and that basically is for teeth that doesn't need too much work on, and it's just minor crookedness. So they shave the top portion of it only, and they put the laminates on top just like a fake nail, and everything is fit together perfectly. Everything is measured. Make sure that when you smile, the aesthetic teeth show perfectly according to how your mouth opens. So that's basically these aesthetic parts is really carefully calculated. We take photos in our studio of the patient, and we do all these procedures before we start even treatment. And after that point, we make mock-ups of the teeth, how it's going to look. So we do digital smile design, so that the patient has an idea about what their teeth is going to look like at the end. And that's one of the treatments that we get really asked a lot of. And the other one is implant treatments. And implant treatments is extremely expensive in the US and also the West.
What is the numbers that we're talking about approximately, just to get a comparison?
So basically, each implant it costs in the West somewhere around $4,000 to $7,000, and we basically in Turkey, what makes it more really appetizing for patients is, oh wow, I mean, I can get this done at a quarter the price or much less. Now, sometimes they end up saying, okay, you know what? Why can't I get it down to the cheapest possible? And that is when things go sideways. So when you want to consider this, first of all, you need to consider where the implant is made and how long of a history it has, because there needs to be some sort of a science behind that implant. It can't be from a company that has been around for just a couple of years. And there's such implants out there in the market, and of course their prices are dirt cheap, and sometimes it's actually not even medical grade titanium, and this is basically really like poison for a human's body. And when you put this in the jawbone, it gives these ions, and it can actually go through the bloodstream and go into your liver and some other parts of your body, and it can really create some bad illnesses. That's why do not try to get the cheapest price out there. That is not the best way to get a treatment done. And most of the time, this is what we've been trying to educate our patients in, is try to compare the price to your hometown. and not necessarily when you get to Turkey, oh, you know what? I just got my implant done for that, but there's another clinic that is doing it for, 50% less or 80% less. We have to stop and think for a minute. I mean, there's a cost of the implant, right? And the cost of operating the clinic and everything else needs to be included in that price, right? So if it is extremely cheap,
You should be worried.
a nice treatment out of that, it's not going to happen. It's basically it's going to be a problematic, piece of treatment, and that's why when I say the patients need to really do their research, not only with the pricing, but also the quality of the service that they're going to receive. And this is a few things that is combined. Number one, it needs to be done by a dentist that is professional in that part of dentistry. So a lot of dentists, they apply implants without actually having education in implantology. And that is a big no-no. I mean, just like anything else, just because they're a dentist doesn't qualify them to do all these different parts of dentistry. So you have to find yourself a dentist that is qualified to administer that treatment for you. So if you have a gum disease problem, a periodontist needs to take care of you, not that somebody else. So all these different things, the patient has to educate themselves, and that's what we do.
You guys do assess patients all remotely, because just the way you're interviewing with me right now, you're speaking to all of your patients, because most of the time they do come from abroad. But is there ever anyone who can directly assess them? So what's sort of the process of consultation? Just talk me through what you would normally do from start to finish.
Once they communicate to us, they are speaking with an agent that is directly communicating to the professors in the clinic. And each case that we take in is actually analyzed by these professors. We have a meeting room where they all sit down every day, and we take all these requests, and it takes them literally a few minutes to analyze the photos, the clinical photographs of the person's teeth. And also what we need, the second thing we need is a panoramic x-ray. A panoramic x-ray is a perfect way to get a comprehensive look at the general health of the person's mouth. So our professors can take a look and see if they have cavities, if there is any receding gums, the quality of the bone, if there needs to be done. So many of these things can be answered with just one glance and analysis of our professors. And once we do that, we get back to the patient and we give them options. So we say, okay, here's your treatment option number one, number two, number three, or if there is any, or maybe they don't have any options, there's only one thing that can be done. But we give them all these possibilities, and we create a treatment plan, and we give them a time frame and also a price quote. And all this is done customized per patient. And once we communicate this to them, then they get back to us. If it's, of course, we have to consider their budget, their time frame, their general health is another issue. If they are taking some sort of medications, if they have a heart disease or a diabetic patient, or any of these things, we have to consider before making these treatment plans. So first and foremost, it's the health of the patient. That's the most important part.
How would you assess that? Would you assess that remotely as well, just by looking at their medical history and by using the information that they have, or is there something that you would undergo as well to make them to assess them for suitability?
We definitely do this by requesting their general health, basically information. We have to consider these things when creating the treatment plan. For example, if a patient is receiving chemotherapy, they cannot receive dental implants. So we have to know this beforehand before the patient actually arrives here. So if they neglected to tell us that, they could arrive here and the dentist will have to refuse treating because they're taking, chemotherapy. So all these different details need to be taken place before they actually plan their trip to Turkey. And we go over all the details, make sure that nothing is left out. And once everything is set in stone, then we say, okay, now you're ready. And we give them the treatment plan, the pricing, and also the length of stay that they would need. And once everything is set, then hopefully they will arrive at our clinic and their first clinical exam takes place. Not everything can be seen in an X-ray. So there are certain things that can be hidden and that can show up in a clinical exam of the dentist. So that is one of the things that we communicate to the patient as well. So we get in as much information as we can initially through an online consultation, but at the same time, there is that 10% that we cannot see. And that might come up. It's not always, but there are times that it does that come up in a clinical exam. And once we do find that, there might be some additions to the treatment plan or subtractions. So we might not do some of the things that we thought was possible. We might not be able to do them, or we might be able to add some things because we saw a problem that was not evident before. So those are the things that we consider when we create the treatment plan remotely.
And I guess that's also very important because I guess a lot of clinics, they just don't undergo such thorough thing. It's like, okay, patient wants treatment X and they want to get treatment X as soon as possible and as cheaply as possible. So I guess to have these thorough examinations are quite important. So how long do patients usually stay in Turkey for these treatments?
It depends on the treatment they get, but most of the time for, let's say, a Hollywood smile. When we say a Hollywood smile, it's basically the aesthetic teeth that show up when you smile. So it's 8 teeth on the top and 8 teeth on the bottom. Most of the time, those are the teeth that show up when you smile. So that's a total of 16 teeth. So if they wanted to get all of them done, let's say that there's a lot of crowding, there's a lot of problems, a lot of issues with the teeth, and they need to get 16 teeth done. Then at most, you're talking about a 10-day stay. It would have to take a week to 10 days. And this is because we're working with a lab, and there's a lot of talented artists working behind the creation of these teeth. So I mean, you got to see them. It's a beautiful like a harmony between the dentist and the lab technician. It's not a one-man show, so to speak. So basically, the dentist creates the vision. It's like the architect of the whole thing. And the lab technician is the actual the worker that puts in the work. And they need to both work together to create this teeth to look as natural as possible. When you think about the transparency, you probably have seen people doing, Hollywood, so to speak, like a Hollywood smile, but it looks like a one block of white teeth. It just doesn't look natural, and those are the ones that they don't use the right basically material. They use zirconia, and they don't work with probably the best laboratory technicians. So it's really important that the dentist works with a lab tech that is using high quality products like Emax. Emax is what we use for Hollywood Smile. Our dentists would give you much better information about them and how it's used. But it gives that the translucency of light breaking and the teeth color, just like in the natural teeth. So this is the most important part that we take pride in, is that we try to create the most natural looking teeth possible, not just by its looks, but also
By its feel.
function. Yeah, the function is really more important than the looks, and people try to always push that aside and put it in second place. But functionality is by far the most important part. It's basically your teeth is your health. I mean, it's what gives the whole body. It's the gate. It's the gate of food. It's the gate to all the bacteria and everything else. So you don't take care of it, or it doesn't function properly. It does cause other health problems along the line.
What does the maintenance part of that look like? So how long would we consider that Hollywood smile to have its longevity? Because I understand that after a certain, well, maybe after a decade or so, you have to replace them.
It's all dependent on how it's used. There are patients that, we've had patients that crack walnuts with their teeth. I mean, it's certain things that you do that you wouldn't do with your own teeth. I mean, you shouldn't do with, your Hollywood teeth as well. I mean, there's people that have this notion that they believe that once they get the implants, or once they get these teeth, it's going to be hard as diamonds, and they can do whatever they want to open a bottle of beer. I mean, it's we've had really our share of patients that have these wrong type of information about what they are. You have to be as protective of them as you would your own teeth, because these Hollywood smile teeth, it's actually bonded with your own tooth, and it becomes your own. So you have to take care of them just like regularly. You have to take care of them, brushing, flossing, whatever. You have to do your regular checkups as well with your dentist abroad. So you have to go to your regular checkups, make sure that your oral health is in good shape. And once you do that, they can go as long as possible. It's much more than 10 years.
So so if I'm in my mid-20s right now, would I be able, if I got my teeth redone, would I be able to have them until late into my mature years? Or what just to throw a number out, just give me a number.
Okay, I'm going to throw a number out for you. How long do you think your own teeth are going to go for?
As long as possible, hopefully.
So basically, you would think that because you say you're going to take care of your teeth, right? And you're going to do your regular checkups. So this is going to actually diminish the amount of possibility of any kind of gum disease or any other oral health problems, because these are the things that actually play a big role in the health of the new teeth that you have put in. So basically, just like your own teeth, there's no guarantee that your own teeth will last you a lifetime. You might get cracks in it. You might get a lot of things wrong with it, right? I mean, anything can happen. It can weaken over time. And this is the same thing. You have to take care of them. As long as you take care of them, just like your own tooth, they can go and serve you for up to your 40s, 50s, 60s, whatever. It all depends on how well you take care of them, and if anything wrong with them, you have to see it before it happens. See, this is another problem with health. People are scared to go to the dentist. That's a general rule, right?
Including myself.
I myself included, but that's a really bad thing to do, because most of the time there are things working in the background without giving a symptom. That's the problem. So there could be a cavity that is working its way through without you even having any pain. But by the time you receive that pain, it might be really too late. So that's why it's really important to periodically go to your dentist and have your checkups. Make sure that there is nothing working its way through to your root, so to speak, and make sure there's nothing bad going on. And once you do that, that is going to really help you, do your teeth cleaning every year, once a year. And doing all these things really protect your investment. Basically, this is an investment. It's an investment to your health and not just your looks. As long as you take care of it, it's going to serve you for a very long time.
So do veneers and crowns actually protect your natural teeth as well from getting anything? Because of course you put an additional layer, an artificial layer on top of your own teeth. By shaving part of your teeth off, you make them hypersensitive. And I had stuff done on my teeth, even though I haven't undergone any hyperdental treatments like the ones that you are describing. But I understand what it feels like to have a hypersensitive tooth and just be sensitive to everything. And I guess one of the main reasons that people are concerned about turkey teeth treatments is that they don't know how badly is that gonna also affect them. Speaking about myself, I have very sensitive teeth, and I do experience pain easily on my own teeth. So for me, the concern would be what's the pain factor here for people. I understand you can't do much with your teeth, especially within the first few weeks of receiving your implants or your crowns, your veneers. So what's the how quickly can people lead a normal life after having received that type of treatment?
I'm so glad you asked that question, because I think the most important thing, like we mentioned, is that you work with a true professional. When you work with a really professional in their field, let's say implantology, right? They know exactly the amount of time that it's going to take for you to be able to, have regular food, or which is what we do is we give a pamphlet out to our patients for every treatment that they receive, whether they got a wisdom tooth pulled out, or they had an implant treatment, or they had a Hollywood treatment. We give them an informative leaflet, so it details what they can expect, what kind of complications could occur if there's any. So all these things are in detail, it's to inform the patient and make sure that they know what to expect. Because most of the time they don't know. And most of the time when they go to these clinics, let's say that they had a wisdom tooth pulled out, and all of a sudden they have this huge, maybe a swelling in their jaw. And they're like, is that normal? What's going on? I mean, and most of the time it is. As long as they put some, cold compression down, it minimizes this. But most of the time, patients panic because they're not well informed. Just like you said that you have sensitive teeth. The dentist would have to actually really assess that with the patient. And if there need be, you might have to have a canal treatment where they would take out the nerve of the tooth. So your tooth has, in reality, it's just become an organic implant because it's not alive anymore. Its nerve is removed, but it's nice and strong. It's on there, and it just has this crown on top, and there's no way you can feel pain after that point. Because that tooth is no longer serving any nerve endings. So sometimes with patients, we have to do that, and we have to give that information to the patient. We have to warn them and tell them that, listen, if we do this, you have really sensitive teeth, so we might have to do root canal and remove that nerve so that you won't perceive any kind of sensitivity after the procedure. And we give that warning, and if they're okay with that, which is not something we prefer to do, by the way, there's no it's not worth it. It depends on how badly we have to assess that with the patient. It's about the health benefit compared to what they receive and what they're going to get rid of from their life, which is a nerve ending. It's not something simple, so they have to decide that with the patient, the doctor and the patient, and basically they come up with the best solution to fit what the patient wants, and not only what he or she wants, but what is best for them. And they have to decide that with the doctor. Because sometimes what the patient wants is not really the best option. And we have had many patients like that. They come up and they say, "Oh, I'd love to get an implant here, here, and here." Well, it's not possible because we tell them that you don't have good enough bone structure, and if we did those implants, you're going to lose them eventually. Like after a year or two, they're going to come off. So there's always that risk. There's always a risk with any kind of treatment that you receive. But what's important is that the patient understands all the risks that are involved, and there is nothing in fine print. Everything is transparent. They know exactly what they're getting and what to expect and how to take care of whatever they received. Because nothing comes free in that sense. You just don't pay for a treatment and it's all over. It's done with it, or you're done. It doesn't work that way. If you receive an implant, there's a certain things that you have to do as a patient to take care of that implant. You have to do your regular checkups. You have to make sure that you follow your doctor's advices on how to treat your teeth. How often you have to go to your checkups, and there's a bunch of other things that you have to actually follow through just to make sure that that treatment serves you to your late life. So this is what we try to do, because the reason this makes us really popular in a sense is because this is a professor's clinic, and they love teaching. So they love informing the patients about what their treatment is about. And just like, they're teaching their students in the university, they're doing the same thing with the patients. They don't shy away from that. They love teaching because an informed patient is really the best patient.
Absolutely.
They're going to basically know exactly what they want that is going to be good for them. That's what we're trying to establish here at the clinic most of the time.
And that is important. That is important. As you said to me, the most frequent question asked to you is, do people speak English in your clinic?
Yeah, we get asked that a lot, because I guess there's a lot of clinics that they don't have any English speakers around. I mean, especially they might have translators, but of course, when you lost in translation, there might be a problem when you're trying to communicate. The patient is trying to communicate with the doctor. A translator is most of the time not enough. They cannot explain exactly what's going on, and that creates a problem when creating the treatment plan. I mean, our founders basically have been educated in London. They have really good English skills. They were basically a professor in NYU, New York University, Faculty of Dentistry. And they're internationally known. So they have always been attending these Congress meetings, and both locally and internationally. And hosting it, they've been attending it, and that really helped them keep themselves updated with all the latest information, and also, of course, language-wise as well. To be able to communicate all these things with the patient is, I think, crucial, especially when creating a treatment plan. And being really up to date with the latest technologies and the latest information is second to none. I mean, that has to be in place in order to give the best service to the patient. And that is, I think, what kind of separates us, is that experience. And also, we keep the patient's health at our most prior of things to concentrate on.
Fantastic. Thank you so much. This was Ege Sandalli for the Healthcast, where healthcare professionals and experts from the UK and worldwide come together to take care of all things healthcare. Thank you very much.
Thank you. My pleasure.